Well, right now, the United States Senate is debating a massive budget plan that's looking to the Energy and Commerce Committee to cut $880 billion in spending over the next 10 years. But there's a problem with that. While lawmakers across the aisle say they don't want to cut Medicaid, that's about the only place that much money could come from. And while any federal budget is miles away from being final, if those cuts end up happening to Medicaid here in Minnesota, they could add up to more than $1 billion a year. Hennepin Healthcare serves more Medicaid patients than any hospital in our state. So Sammy went there looking for answers.
How many medications?
I was chucking them down. Yeah.
How many visits to the Hennepin Healthcare Kidney Transplant Clinic?
Joel Williams, star patient.
There we are.
It's easy to lose track. But what Joel Williams does know is he wouldn't be able to receive this level of care without Medicaid.
I know Joel.
Josh Horn
Joel wouldn't be here today if he didn't have that Medicaid.
is a clinical care coordinator RN.
Did not take him this morning, correct?
He has seen Joel struggle through 11 years of dialysis. 2 years ago, he received a kidney, and now they continue to fight for his body to accept it.
I think he's done enough time on that machine.
The majority of what the state spent on Medicaid last year came from the federal government. $1.6 billion of that could be cut annually.
It is worth worrying.
Nearly half of Hennepin Healthcare's patients rely on Medicaid. That's the largest percentage in the state.
There would be some hard decisions that we'd have to be looking at.
Jessica Oaxaca is an advocacy engagement manager. She says their system will be disproportionately impacted and jobs will be threatened.
Everything is a little bit up in the air.
Decisions are still being debated at the federal level. Lawmakers in favor of the cuts and adding work requirements say it will reduce taxes.
The level of just fear that I have about it is enough to recognize that, you know, there are so many people out there that won't get just the basic care that they deserve.
Joel used to work for the Chicago Police Department and was a referee in schools. But his asthma put him on disability, and his diabetes furthered health and mobility issues.
This is life and death for him, or life and dialysis.
The pills, the visits blended together.
See this big pill,
The care
horse pill, horse tranquilizer.
is what stands out to Joel.
The honest truth is that an institution like this just can't survive without it.
Okay, Joel, what else do you need from me today?
Nothing.
All right.
Sammy Solina,
Just your wonderful, gleeful smile.
KARE 11 News.
I like Joel's attitude. Also up for debate, Medicaid-directed payments. Hennepin Healthcare is the only hospital in our state that gets them. And it gives the system more flexibility to steer Medicaid money towards social and medical complexities like people that have food insecurity, transportation issues. So if that one's cut, they estimate a loss of $140 million in funding.